to our lecturer Dr. Farah Nadia and my friends. My name is Sharmoni Vegamanakam and my metric number is 277756.
Assalamualaikum and hi, my name is Nurain binti Mama Zapiru with metric numbers 279436.
Hi, my name is Ana Suryana binti Harun. My metric number is 277840.
Hi, my name is Tishalini Prabhakaran and my metric number is 277219.
Hi, I am Yunishri Balakrishnan. My metric number is 279965.
Hi everyone, I'm GHAJINI, metric number 278964.
Now we are going to give a psychological review about the film GHAJINI. Psychological issues in GHAJINI film. Psychological issue that illustrated in GHAJINI film is Sanjay, the hero of this film, undergone anterograde amnesia disorder. This happens to him because the villain of this GHAJINI film hits Sanjay with an iron rod on his head. This is because anterograde amnesia disorder mainly caused by injury to memory-making part of brain. The type of psychological disorder that was illustrated in GHAJINI film is anterograde amnesia disorder. Anterograde amnesia is the inability of creating new memories and information. Anterograde amnesia can involve either partial or total inability to remember events that happened before. In this GHAJINI film, Sanjay loses his memories every 15 minutes and uses the system of notes, photographs and tattoos on his body. This is to recover his memory and to remember his mission. Explanations about anterograde amnesia disorder. First of all, diagnosis. Many patients who develop anterograde amnesia disorder suffer from stress, anxiety and depression. Many of them also go through confusion, difficulty in decision making and judgment errors to evaluate whether the disorder is present with other cognitive impairments indicative of dementia. Usually, questions are asked based on the things that they have forgotten, the frequency of memory lapse, and the frequency of forgetting routine tasks. The second thing is symptom. The main symptom of anterograde amnesia disorders are the patients struggling in learning new information, difficulty in remembering previously familiar information, and remembering past events. They are also facing problems with short-term memories. For an example, in this GHAJINI film, Sanjay, the hero of the film, forget all his past information about a shady local figure, GHAJINI, and his associates who kills his fiancée Kalpana Shetty, and he uses a system of photographs, tattoos on his body to recover his memory and avenge his mission. Lastly, the treatment. Some rehabilitation and recovery may be possible while there is no cure and medication treatment for anterograde amnesia disorder. Some strategies such as reminder, beepers, family support, occupational therapy can be used to manage the condition. For example, patients who are undergoing anterograde amnesia can create a system for manage their daily routines by outlining their daily tasks. Thank you.
Do you know how the life be when you are living with anterograde amnesia? Okay, as we know, anterograde amnesia refers to the loss of ability to form or retain new memory after the event occurs. That means they're only able to remember new things for just a few minutes, and after that they will forget it. Because of that, persons who are suffering with anterograde amnesia will have difficulties to live their daily life. Usually, persons with anterograde amnesia will face some common scenarios such as unable to remember a phone number. They also cannot remember the last meal they even ate, may not remember and recognize a person they have met before, and also things they have recently learned. So, as an initiative to cope with the situation, they need like reminders to help them live their daily life. For example, they use some tools like notes and Polaroids to help them remembering something, places and also persons. So what are the impacts of anterograde amnesia to one's life and others around them? Okay, the impacts are the person with anterograde amnesia will live in difficulties, frustration and confusion. This psychological disorder obviously challenging in one's life, especially in terms of social life and working environment. Because of they cannot remember a person, so it is hard to them to socialize and also communicate with people around them. It is also give an impact to their work as they cannot give the best on it. And after that, it can lead to frustration, which is they feel they are useless and helpless. Other than that, anterograde amnesia also can lead to dangerous to them. Someone who are unresponsible may take a chance and trick them on their weakness. To their family and close friends, they will feel hard to deal with the family members or friends who are suffering with anterograde amnesia, which is they need to always keep an eye on them so they will be safe at any place. Okay, in GHAJINI's movie, the character who are suffering with anterograde amnesia or short-term memory loss is the main character, which is Sanjay Singhania. The factor that caused him to live with a psychological disorder is because of head trauma after him being hit with a metal pole when he is trying to save his beloved girlfriend, who was killed by criminals. The traumatic incidents left him with severe injury on his head. Because of the head trauma, he cannot remember new things more than 15 minutes. And finally, he was diagnosed with anterograde amnesia.
Today I am going to explain about the main three theory I have learned from the movie GHAJINI. The first theory I have learned from the movie is trace decay theory. This theory more about our memory. If a person cannot recall or review their memory, it may cause us forgot or deleted their memory automatically from their mind. For example, the character named Sanjay in the movie GHAJINI will suffer from a mental illness, means he will lose his memory within 15 minutes. Each and everything in his life he will forgotten in 15 minutes. It's also called as short-time memory loss. The second theory I have learned from this movie is incongruity theory. This theory is more about the curiosity behavior of a human to understand something. For example, the character named Chitra, a medical student, is very curiosity to study a case about Sanjay, even though her professor don't allow her to study the case because of some issues. But she find out the problem and mental illness going through by Sanjay. The third theory I have learned from this movie is theory of revenge. I think everybody know literally about this theory. This theory is about revenge, which rise when we feel anger, depression, or maybe caused by a loss. Even though Sanjay is a short-time memory loss patient, he never ever forget about the incident. The villain killed his fiancée and he revenged back to kill the villain to pay back his girlfriend's murder.
I want to talk about personality of character in the GHAJINI movie. They have three personality of main character in that movie. I choose Sanjay Singhania's character. The three personality of Sanjay Singhania character is melancholic, sanguine, and choleric. Personality means the personality of an individual who has different personality traits. It also be defined as their personal character as well. All work performed reflect the true personality of an individual. First personality of Sanjay's character is sanguine. This personality is cheerful, kind, and optimistic person. Example that we can take from GHAJINI movie. Sanjay is very optimistic by managing his company, which has 1,000 employees. He also kind person. Sanjay's character has a good personality and he always positive in his life. Second personality is choleric. Choleric is a serious person who has this personality are described as having high leadership quality. Example, Sanjay is very serious person and has high leadership quality in himself. This personality state they do something the best they can. Last personality is melancholic. This personality is quiet but considerate person. They like to be aware and think a lot. They also careful and always often on shadow. Example, Sanjay's character changed after he is beaten by criminal who killed his girlfriend. He is suffering short memory loss, and because of that, he always made a note to remember all things.
Types of learning. Learning is a relative change in behavior that occurs through three types of learning. That's are classical conditioning, operant conditioning, and cognitive learning. Classical conditioning is a learning process that occurs as a result of repeated relevance between neutral stimuli and other stimulation, while operant conditioning is a learning that indicated to earn reward or avoid punishment. Besides that, cognitive learning is a learning that associated with basic learning processes such as insight learning, latent learning, observational learning, and hopelessness learning, which is involved mental processes such as which is difficult to see. The type of learning that associated in GHAJINI film is classical conditioning. Sanjay Singhania, who is a businessman and chairman of Airvoice Company, a telecommunication company, loses its memory for every 15 minutes because of antegrade amnesia. Sanjay look up the photos, tattoos, which is established in the whole body, and the notes to restore his memory. This can be attributed to the experiment that even Paulo has done on a dog, which is issued a saliva by simply seeing a food container. Like Sanjay remembering someone or an event, just look up or just seeing the photos, notes, or the tattoos only. This is because before Sanjay had an accident, he did not need any kind of props such as notes, photos captured by himself, or tattoos to remember or recall someone or an event. But after the accident, he needs that things all to remember or recall the person or the events. So, the element that exists in classical conditioning in the film is condition response and condition stimulus. Besides that, Sanjay Singhania feel afraid every time he remembering the black events which is happened in his life, which was sustained in his subconscious memory. This has been categorized as phobia and has been treated by a psychologist by using systematic desensitization.
Hi, I am Unishri Balakrishnan. My metric number is 279965. Today I am going to explain about intrinsic motivation and extrinsic motivation. Intrinsic motivation is the act of doing something that is driven by internal rewards. Intrinsic motivation happens when we act without expecting any obvious external rewards from it, such as money and prizes. Through this, we enjoy an activity or see and accept it as one of the opportunities to learn, explore, and actualize our potentials. In this movie, there's an intrinsic motivation that influences a medical student. The student's name is Sunita in this movie. She tried to study the case of Sanjay Singhania, the CEO of Airvoice, a telecommunication company. She investigated this case even though she is forbidden to do so by a professor. She focused and studies this case even though she does not get any reward like medals or money from anyone. She wanted to explore this case since she was curious about Sanjay's case. The next is about extrinsic motivation. Extrinsic motivation is the act of doing something that is driven by external rewards. This type of motivation exists from outside the individual. Extrinsic motivation happens when we are doing something by expecting any external rewards like fame, money, and praises. In this movie, there is an extrinsic motivation that influences a struggling model. The struggling model's name is Kalpana Shetty in this movie. She is a model who falsely proclaiming herself as a girlfriend of Sanjay Singhania. By this, she gained a lot of fame and praises from her boss and co-workers. After she got this reward, she is unable to reveal the truth to everyone. She continuously proclaiming herself as a girlfriend of Sanjay Singhania without feeling guilty. By this, we know that Kalpana was excited after she gains popularity. She got a lot of attention from her boss. She became a wanted person in her field of work. Because of this, she was unable to reveal the truth since her career took a high reach after she told this lie. Therefore, we can understand that she is driven by extrinsic motivation. That is all from me. Thank you.